We are speaking to Sister Nellie of the Cancer Association of Namibia. Sister Nellie, the 4th of February will mark World Cancer Day. What does this day mean and how is this day celebrated in Namibia?
World Cancer Day is where we can make people more aware about cancer and the facts of cancer, because there's a lot of misconceptions about cancer in our country and worldwide. So that is just to make people more aware about what is the true stories about cancer. And then at the Cancer Association, we have got this day to make also people more aware about cancer and how to prevent cancer. And with this day, we have got a bonsai exhibition where people can come and visit and have a look at the bonsais from the Commas Bonsai organization, and also to get pamphlets about cancer, to ask questions to us if they need to know anything about cancer.
I understand that this year's World Cancer Day is a chance to raise actual facts on cancer and to dismiss misconceptions around the disease.
There's a few misconceptions. There's one is that it is just another health issue. But if you look at facts, then you can see that about 47% of cancer cases and about 50% of cancer deaths are in the underdeveloped regions in the world. So it is not just another health issue. It is really a serious illness that can affect everybody. Then there's also the myth about that cancer is only for rich people, and that is also wrong, because most of the cancer deaths is in the underdeveloped countries. Then the other myth is that cancer is a death sentence. That is also not true. About 30% of cancers can be prevented. By prevented, I mean we have to look at our lifestyle. There it comes in using sunscreen to protect your skin against skin cancer, to stop smoking or don't start smoking, to eat healthy, to do exercise, to eat a lot of fruit and veggies, to lessen your stress factors and things like that. And in our time, most of the cancers can be cured.
Sister Nellie, what is the role of the Cancer Association of Namibia?
The Cancer Association is there for all the people in Namibia. We've got 3 main functions. One is about research that we do with the help of the oncology unit in the Dr. A.B. May Cancer Care Center at the Central Hospital, where we see where we've got different types of cancers that are more prevalent in which regions, and then also what is a risk factors for cancer. Then we have got information, and information is where we talk to people. We go to anybody who wants to have a talk about cancer. We go to companies, we go to schools, we go to church functions, any place we can talk about cancer. And we also give pamphlets, and we have got posters, and we also do pap smear clinics to make people more aware about cancer, its consequences, what is the warning signs for cancer, and then also what you can do to prevent cancer or to pick it up early.
Which type of cancer is the most prevalent in Namibia?
Skin cancer is #1 cancer in Namibia. We're sitting now in the sun. Luckily, this is one of the shade that can keep out a little bit of sun. But it is so important. That is one of the factors that we must look after our skin. We must wear skin protection. We must wear hats. We mustn't go out in the sun between 10 and 3 in the afternoon. We must teach our children also to wear hats and to put on sunscreen, so that they can start from young on to protect their skin, because when you are older, then it's a little bit too late, because some damage are already done.
What are the challenges faced in Namibia regarding cancer treatment?
There's a lot of challenges, because there's also a lot of myths about cancer treatment. Because your cancer treatment has got different phases. There is a surgical phase where cancer must be removed. You get chemotherapy, you get radiation therapy, you get hormone therapy. Now some people think when cancer are cut, they will die because the cancer will spread because they were cut. That is not true. Sometimes when people die after operations, it is just because the cancer was already spread through the body, and there wasn't a chance that the person could survive the cancer. Cancer only spreads through your bloodstream and through your lymph stream. Chemotherapy, another myth is that chemo will kill you. That is not true. Unfortunately, it has got side effects, and that side effects can make you seriously ill. But that is why it is so important that people go for their blood test with the doctor's order, because they look at the blood and see, can we give this person chemo today? Isn't his blood counts too low? And then they won't give him chemo. They will wait for another day or two. So it is very important that people must go for their treatment. Radiation is also important because that kills the area where the cancer was removed. It kills any cells that have stayed behind from the cancer, and it can't kill you. It is just there to get you healthy. So there is a lot of misconceptions about treatment, and people must just listen to their doctor. They mustn't listen to other people. Because that is what our people do. We listen what the other persons say, you know, and then we believe them, and then you don't go for your treatment, and you will die in the end if you don't get any treatment.
Okay. Sister Nellie, thank you so much for speaking to Nampa News. I am Sawi Hausiko reporting for Nampa News, WINDHOEK.